Hello everyone, this is Mr. Matus, and for today I'll be discussing your Renin-Angiotensin-Aldosterone Mechanism. This process is very important for nurses to understand when they are taking their NCLEX examination, especially that some drugs act by blocking some of the elements of this process. And also to understand what happens when patients have hypovolemic shock, how the body compensates, and also to understand the pathophysiology of hypertension in some cases. So let's proceed and discuss this topic today. So the renin-angiotensin-aldosterone mechanism plays a very important role in regulating the blood volume and systemic vascular resistance in the body, which together influence the cardiac output and the blood pressure. So as the name implies, there are three important components to this process. One is your renin, and number two is your angiotensin, and number three is your aldosterone. So the question is, when does this process start? When is renin released? What causes the body to start this process? So the process starts when the body senses that there is a decreasing blood pressure or a decreasing blood volume. So for example, the person has massive hemorrhage, for example. The body will start the process because of a decreasing blood volume or blood pressure. So next, the kidney will be stimulated to release your renin. And renin will cause the formation of angiotensin 1. With the release of angiotensin 1 and the help of the converting enzymes in the lungs, it will help in the formation of a very important vasoconstrictor, which is your angiotensin 2. So angiotensin 2 will cause potent vasoconstriction that will help in increasing the blood pressure. Now it has to be remembered that with the release of angiotensin 2, it will automatically stimulate the adrenal cortex to release one hormone, which is your aldosterone. And aldosterone will cause an increase in the sodium reabsorption. And with increased sodium reabsorption, that will cause also an increase in the blood volume and subsequent increased blood pressure. So this is the whole picture of the process, which is the renin-angiotensin-aldosterone mechanism. And one NCLEX tip that I'm going to give the NCLEX examinees is that there are certain medications that act on this process by blocking some of the elements. For example, if the converting enzymes in the lungs are being blocked, then the blood pressure will decrease. And these are your medications that we call, which are your ACE inhibitors. And also what I would like you to remember that the starting point of this process is the decrease in the blood volume, and everything ends with increased blood pressure. So this is the body's way primarily when trying to compensate if the body is experiencing hypovolemic shock or decreasing blood pressure. So this is it, everyone, your renin-angiotensin-aldosterone mechanism. So if you have questions, please post your comments below, or before we end, please click like or share my presentation or subscribe to my channel. Or you can also visit my website, which is your www.matusnursingreview.com. Thank you very much, everyone, and have a nice day.